In the wake of the COVID-19 pandemic, another virus is making a quiet but dangerous comeback: respiratory syncytial virus, RSV. Once a routine infection in early childhood, RSV is now resurging at alarming levels, particularly in infants and young children who were born or grew up during lockdowns and strict health protocols. Countries around the world, from the United States and Canada to Australia, Japan, and across Europe, have reported major RSV outbreaks since 2022. Pediatric hospitals have seen a sharp rise in infants struggling with breathing difficulties, many requiring oxygen support or intensive care. But this spike isn't because RSV has mutated into something deadlier. It's because an entire generation of children missed early immune exposure during COVID-19 restrictions, and their developing immune systems are now vulnerable. What is RSV and why is it dangerous for infants? RSV, or Respiratory Syncytial Virus, is a common virus that infects the lungs and respiratory tract. In older children and adults, RSV usually causes symptoms similar to a cold. However, in infants especially under 6 months of age, RSV can lead to bronchiolitis, inflammation of the small airways in the lungs, pneumonia, severe respiratory distress requiring hospitalization. To the US CDC, nearly 100% of children will be infected with RSV at least once by the age of 2. Most recover with mild symptoms, but infants who are premature, have chronic lung disease, or are immunocompromised are at high risk for serious complications. Why RSV is spiking after COVID-19? The immunity gap in a post-lockdown world between 2020 and 2022. Strict public health measures, mask mandates, school closures, lockdowns, and social distancing were crucial in controlling the spread of COVID-19. But these same interventions also dramatically reduce the circulation of other common viruses, including RSV. In fact, in 2020, global RSV transmission nearly disappeared. According to the World Health Organization (WHO), RSV circulation dropped by over 90% in many countries due to pandemic restrictions. While this seemed like a success at the time, it led to a generation of young children who did not build natural immunity through early viral exposure. As countries eased restrictions in 2022 and 2023, RSV returned with full force. In the US, the CDC reported that the 2022 to 2023 RSV season started earlier than usual, peaked higher than average, to double the number of hospitalizations in children under 5 compared to previous years. This immunity debt has become a growing concern among pediatricians. Babies born during the pandemic are now facing RSV for the first time, without the benefit of maternal antibodies passed from previously exposed mothers. In Australia, France, and Canada, similar trends were reported. The 2022 RSV wave overwhelmed pediatric ICUs, with hospitals recording record-high admissions for bronchiolitis and pneumonia in infants younger than 12 months. Public health experts now warn RSV hasn't changed, but our children's immunity has. Global RSV trends from 2022 to 2025. What the data shows: the RSV resurgence has not been isolated to one region, it's a global phenomenon. Here's what recent data reveals. United States. During the fall of 2022, the US experienced its most severe RSV season in years. According to CDC data, over 100,000 pediatric RSV-related hospitalizations were recorded during the 2022 to 2023 season alone. Emergency rooms across states like Colorado, Texas, and California reported operating at full capacity as early as November 2022. Canada. Hospitals in provinces such as Quebec and Ontario faced similar challenges. In late 2022, some Canadian pediatric hospitals were forced to postpone elective surgeries to make room for RSV cases. Australia. Australia's 2022 RSV epidemic saw over 33,000 children under 5 test positive, nearly twice the pre-pandemic average. The outbreak arrived unseasonably early, disrupting typical seasonal patterns. France and EU. According to Santé Publique France, the country faced a triple epidemic in late 2022 as RSV, flu, and COVID-19 spread simultaneously. RSV accounted for 80% of pediatric visits for respiratory issues during that winter. Vietnam and Southeast Asia. Though RSV testing is limited, hospitals in cities like Hanoi and Ho Chi Minh City reported rising cases of bronchiolitis in infants. Pediatricians caution that RSV is often misdiagnosed as flu or COVID-19 due to symptom overlap. Health authorities now recognize that post-COVID children are more immunologically naive, making them more vulnerable not because viruses have changed, but because their immune systems haven't yet been trained to fight them. Recognizing the signs, when to be concerned, symptoms often start mild, resembling a common cold, but in infants, they can escalate rapidly. Parents and caregivers should monitor for rapid or labored breathing, wheezing or grunting, nasal flaring and chest retractions, feeding refusal or lethargy, bluish skin around lips or fingernails in babies under 6 months. Pauses in breathing apnea can be a dangerous early sign. These symptoms require immediate medical attention. How to protect children from RSV? There's no cure for RSV, but these measures help reduce the risk and severity. Breastfeeding transfers maternal antibodies that help fight infection. Hand hygiene. Wash hands frequently and disinfect surfaces. Limit contact. Keep infants away from sick people or crowded places. RSV vaccination for pregnant women, approved in 2023, Abrysvo protects newborns by passing antibodies from mother to fetus. Monoclonal antibodies. Drugs like Beyfortus nirsevimab are available for high-risk infants to reduce severe RSV risk. Global Health Outlook. What WHO and CDC recommend in 2024. WHO classified RSV as a top pediatric respiratory threat, encouraging global monitoring and vaccine rollouts. By 2025, the CDC is integrating RSV immunization into maternal and infant care plans. Multiple countries are piloting RSV vaccines and seasonal protection programs for newborns. This marks a proactive global shift to address a virus once overlooked in public policy. A new era of vigilancers has always existed, but the pandemic changed the game. Children born between 2020 to 2022 are now meeting viruses for the first time without built-in immunity. The resurgence of RSV reminds us, it's not just new threats we must guard against. Sometimes, the oldest viruses come back the strongest, especially when our defenses are down. Understanding the signs, strengthening immunity early, and staying ahead of public health guidance are the keys to protecting our youngest in this post-pandemic world.